Hi, I'm Emily Smith and I'm a genetic counselor here at the Health Nucleus. Today I'm going to go over your genomics reports, what we call the GCR. This report has several sections, and so I'll go one by one through these sections so that you can have an understanding of what's here. The first section is our monogenic traits section. In this section, we go over genes that potentially could have a large effect all by themselves. An example of this would be the BRCA1 and 2 genes. If somebody has a mutation in either BRCA1 or BRCA2, it may cause a risk to have breast cancer, ovarian cancer, pancreatic cancer for people. And this is an increased risk, and there are guidelines on how to follow up with that in management. So that would be something in this monogenic traits section. Also in this monogenic trait section is what we call carrier variants. So carrier variants are things where a parent would have one copy of a gene change and they are unaffected, but it could affect a future generation of their family. An example of this is something called cystic fibrosis, which is a chronic lung and pancreatic disease where a child has the condition and both parents are carriers. So the concern with carrier variants is if you are a carrier and your reproductive partner is also a carrier, there's a risk to have a child with these conditions. The next section in this report is what we call pharmacogenomics. And what pharmacogenomics does is looks at genetic changes that may explain how your body metabolizes certain medications. And these medications may be common medications that you can take at any point in your life. And so having this information can have value for you because if you know that you are a faster metabolizer of certain medication, it may mean that it won't work for you. It won't be efficacious because you've processed it way too quickly and there's no therapeutic effect. On the other side, it could be that you are a slower metabolizer, which means that it's in your body a lot longer and you have a higher risk of having side effects. Having this information can be valuable for you, for your physician, for your pharmacist, so that you can get the right dose of the right medication at the right time. After the pharmacogenomics section, there is what we call our health predisposition section. And in this section, we are looking at common diseases like coronary artery disease, diabetes, thyroid cancer, where we may not have a single gene that has a large effect. If we did, it would be in that first section we already talked about, the monogenic risk section. And so what researchers have done, because we know that a lot of these diseases have a genetic component, is that we figured out that there might be a lot of genes that have a small effect, a small additive effect. So having gene A and gene B and gene C might mean a higher risk, and having gene E, gene F, and gene D may be a lower risk. And so what we do in this section is look at these common diseases and look to see if you have variants that are associated or not associated with these different common diseases. And we add up a score for you. And so this is called polygenic risk modeling and polygenic risk scores. And so you'll see in this section that we give you a percentile. And so this is comparing you to a control population and how likely your genes look like people that have these conditions compared to people that don't have these conditions. And so you'll see that you're in a certain percentile of risk. Keeping in mind that if you're at the 100th percentile or the 90th percentile, it's not a guarantee you will get disease. Just as much as if you are at the 5th percentile or the 25th percentile, it doesn't mean you won't get these diseases. Basically what this is taking into consideration your genetics in a vacuum without consideration of your lifestyle, of your diet, of your family history. And so this can be one piece of a larger puzzle. So for example, lab values or imaging studies that you do here at the Health Nucleus that can help us to help you to optimize your health and add all that information together. Following the polygenic risk scores is what I like to think of as the fun part of our genetics report. It is our health and wellness traits. So these are looking at things like, do you have a risk for having vitamin deficiencies? How well do you metabolize caffeine? Are you more likely to taste bitter things or sour things or sweet things or salty things compared to others? All of this information is more of the recreational, the fun things that you can learn about yourself. And as it relates to things like vitamin deficiencies and caffeine metabolism, if you have a concern about it, it's definitely something you can talk about to your Health Nucleus physician or your primary care physician, but we wouldn't treat you or change anything from your diet based on genetics alone. It's similar to polygenic risk scores in that way, because we know that this kind of genetic information these single variant kinds of things are a small part of a larger piece. So with that concludes going over your GCR or your genomics report here at the Health Nucleus. If you have questions, you're more than welcome to contact your longevity physician or me, your friendly genetic counselor. Thank you so much.